This episode of the Senior Rehab Podcast is sponsored by the Academy of Geriatric Physical Therapy. AGPT's mission is to further your ability to provide best practice physical therapy and to advocate for optimal aging. How do they do this? Well, one way is by connecting like-minded individuals around a specific topic. We call these special interest groups, or SIGs. One SIG is a health promotion and wellness special interest group. I highly encourage y'all to check out some of the work they've done, especially with their presentation on physical activity, a key to successful aging. You can access this presentation for free and learn about how the AGPT can further your clinical practice at geriatricspt.org/SRP. Hit me!
This is a Senior Rehab Podcast, the podcast for rehab clinicians that want to better serve older adults.
Hey there, Senior Rehab Podcast listeners. I'm Tyler Spaceman.
I'm Erin Carey.
And this is SRP Rex. How are you doing?
I'm doing quite well. How are you?
I'm good. Nothing to complain about.
Are you sure?
Well, not on line or not something that I want to share with the people that are interested in making geriatric rehabilitation better.
They don't need to know about my personal problems.
I mean, they can always ask. It would be nice, but all right. So what do we have for today?
Today, we have an article that was published in February 2017. It is an open source article. It's called A Preventative Lifestyle Intervention for Older Adults, a Randomized Controlled Trial. And it is published in Age and Aging. So the...
Age and Aging?
You know, it just says Age Aging.
Oh.
I think it's Age and Aging.
Okay.
I should really know.
Age Aging.
Age Aging. So it has 16 authors.
Well, what university or institution was it in?
There were 4 different universities. They were all in the United Kingdom. So the University of Sheffield, University of Bangor and Wales, University of Nottingham, and 2 more. So actually 5.
Whenever somebody says Sheffield, it makes me think about The Nanny. I don't know if...
The show?
Yeah.
I used to watch it, but I don't remember
His name was Mr. Sheffield. Mr. Sheffield!
All right. That's our nostalgia for the day. So I'm just going to talk about the first 2 authors because that's all I really had the patience to look into. The first one is Gail Mountain. She is a professor of applied dementia research and an associate dean for research in the Faculty of Health Sciences at the University of Bradford in the UK. She is also an OT, and I really, really hope she has a secret metal band because her name is awesome.
Yeah, Gail Mountain.
Gail Mountain! Anyway.
Also, she sounds more like a country singer.
I could see it. Like John Denver, Gail Mountain.
Yeah.
Oh, you're
right. Take me home, country roads.
The second author is Gil Windle.
Gail
and Gil.
They are so British.
Yeah. Oh my God. And honestly, the way they wrote this article just made me think it was someone a little cross about this and the other thing. And then I realized I was reading it in an accent and that was silly. So Gil Windle is the acting director of the Dementia Services Development Centre at Bangor University in Wales. She is a social scientist, and she's very active in advocating for older adults in Welsh policy. That's pretty much it. We're just going to go with those 2 authors for now.
Okay.
For our authors of the day. Yes, Tolly? Do you want to...
Our authors of the day are Gail Mountain and Gil.
Gail and Gil. All right, so... They start out by talking about how a relationship exists between social activity and morbidity and mortality in late life, as well as between meaningful activities and mental well-being.
Yes, we already talked about, remember, purpose in life.
Oh, yeah. Yes, we did. So they talk about this intervention called Lifestyle Redesign, which is an occupation-based intervention to promote continued participation and engagement, and has been shown to improve mental well-being in older adults in the United States. So this study was to reproduce a United Kingdom version rebranded as Lifestyle Matters to see if they get the same clinical and cost effectiveness. Which, I don't know, I think lifestyle redesign, very US, yeah, trendy, eye-catchy. Whereas the UK version is lifestyle matters. Very frank, to the point, no buts about it.
Yeah, less of a hashtag and more about, okay, that's what we're gonna do.
This matters. Yep, big differences. For the methods, they took 2 contrasting United Kingdom sites, one urban and one rural. They took community-dwelling older adults over the age of 65 through informing community health and social care practitioners, as well as eventually general practitioners, because they couldn't get enough subjects to have the adequate amount of power, which they describe as a limitation later. Because the United States version just recruited people from community centers.
And here they just did it from doctors and...
They started by doing community health and social care practitioners, which I don't think we have those here except for like social workers and hospitals.
Yeah, we don't.
Right. And then later they added GPs as well as a recruitment strategy.
Okay.
The intervention was designed to improve well-being and avoid decline associated with poor mental health and social isolation. It was a weekly group of 12 or fewer people for 4 months, plus monthly individual sessions with a facilitator, which was an NHS social care staff person who was trained and supervised by occupational therapists.
What's an NAA?
National Health Service. So that's the socialized United Kingdom healthcare conglomerate, I guess. Session topics were from a manual or they were brought up by participants, and the group explored the topics through discussion, activities, and community enactment. So, like, for example, a topic could be about urban blight. So first they talked about it, then they did activities together that are related to urban blight, and then they would go volunteer in an urban community.
How long was each of the meetings?
I'm not sure.
Okay.
I think a couple hours.
So it's just they just met for 4 months, like...
Yeah, once a week.
Once a week.
Mm-hmm. Then what they did was they identified participants' goals and empowerment through sharing of strengths and skills and supported them and enabled them to practice new activities independently.
Okay, that I like. That instead of, let's come and talk for an hour, it's, okay, we have a goal to work towards.
Yeah, and then they can go and be active in their community to learn more about it and be more engaged.
Yeah.
I honestly was reading about it and I thought that I wanted to try it. Even though I'm not technically the target population, it just sounds like fun. Like, you get together with some like-minded folks, you talk about things, you do stuff together. It's like board games.
It's like why I want to join AA. We have common interests.
So what Tolly gleans from this so far is that it's like AA.
Hey, you meet with people that have the same hobbies.
You do community activities.
And they're donuts. I don't like donuts. I like bagels.
They probably had tea.
Ooh, yes. Tea and biscuits.
I mean, this is the British version.
Yeah. Yeah, their coffee's not good.
Exactly. Yeah, no, they had tea for sure.
Yeah.
They didn't say it in the paper, but, read between the lines. All right.
Sorry, go ahead.
It's okay. So then they did video recordings of their sessions, and the recordings were evaluated by 2 independent researchers to assess facilitator fidelity to group intervention and group member performance. So it was really rigorous for being such an open sort of topic, which I really like about this study design.
Okay.
The outcomes they looked at were assessed at baseline, 6 months, and 24 months. They included the Short Form Health Survey, or the SF-36, Patient Health Questionnaire. They also used the EQ-5D3L, which they didn't define, as well as
DJG,
Loneliness Scale. Making a comeback.
Yes. A reference to something you probably didn't hear.
New listeners, please go back to the loneliness episode for that joke.
Yeah.
And some context.
It's just like it's a very reliable source to evaluate loneliness, and mostly used in Europe. In the US, they use another one.
Yeah, so this was the British version, so they used the British Loneliness Scale. Of course they have their own. So then they also had the General Self-Efficacy Scale and the Office for National Statistics, or ONS, Well-Being, which they didn't say if it was a scale or a survey or what it actually was. There was a reference. I don't know. They just looked at a bunch of different things at all these different times. So then they calculated how many participants they needed for adequate power, and they also calculated cost effectiveness via reference costs that were available through the NHS, as well as quality adjusted life years. They did a lot of blinding. It was a randomized controlled trial. It was a really beautifully set up study. What do you think they found?
That loneliness level has decreased with the sessions.
Cool. What about things like the SF-36 or self-efficacy, anything like that?
Self-efficacy would increase. I don't know if it would increase in 6 months and then drop down a little bit, but definitely would increase from baseline.
Cool. Fun hypothesis. Unfortunately,
there any
you're wrong.
Of them wrong? Yes, I knew it. I knew it because she looked at me like, "Oh, I'm gonna let you talk," and then
It's more fun that way.
yeah.
So pretty much 6 months, there were no differences in any of the outcomes in question. At 24 months, the scores on the two subscales looking at emotional loneliness and social loneliness were significantly improved in the intervention group, although they note that this is limited since there's no minimally clinically important difference value for these scales. So they pretty much found no difference. They also found that the cost per person was £430 in North England, which translates to...
Oh, wow, it's around $650 or something like that.
I calculated, it's right there. Cheater, you looked.
I did not. Well, how much is it?
It's
Ooh, I was very
$649.
close.
Yeah, you're really close. That was in North England, which was the urban environment. And then in the rural environment, it was £575,
Ooh.
which translates to about $870. So, in the discussion, they pointed out that their hypothesis was not supported. Lifestyle Matters is not an effective intervention for improving the well-being of older adults. They found that the differences between the United States and the United Kingdom cohorts were that the baseline SF-36 scores were a fair bit lower, I think like 10 points lower in the United States.
Yes.
Yeah, exactly. So we had more room to improve.
Uh-huh.
They also, in the US, they pulled their population from retirement communities and private homes, and everyone who was included in the study visited community centers regularly. So they were people seeking that sort of social engagement. Whereas this population, although they were also independently living, they were not necessarily having involvement with these community centers. So they maybe weren't in the stage of life where they would benefit the most.
Interesting. Did they say what was the average age and stuff like that?
The mean age was low 70s. So in the intervention, the 72.1 years. And it ranged from 65 to 92.
Also, I don't know if they said what was the retirement age in the UK as opposed to the US.
It's 63 for women and 65 for men.
Okay.
And this cohort was far more women than men. So everyone was of retirement age.
Yeah.
That's a good question. I'm glad you asked that. They hypothesized that recruiting from an existing support group enabled recruitment of those with lowered mental well-being, which we discussed a minute ago. And then they start their last paragraph with this. Identifying older people when they are beginning to decline and taking action at that point is crucial to the success of preventive interventions. Proactive recognition and signposting strategies are required. So although they didn't find anything, because there were differences between the two, I feel like, well, they acknowledge that this is actually some really good information. Like, we need to be specific with these preventive interventions.
Yeah.
Yeah.
No, I like when sometimes when people do a study and don't get the results they wanted, they sometimes either don't publish or publish in, only in the internet or something that is less accessible.
Right.
And I like when people publish, although they didn't get, the hypothesis was not proven, because it gets us closer to look at other things, or, okay, maybe we need to tweak this hypothesis a little bit, or the methods. So, and you can see that in continuum to what we said about in the loneliness episode, that the UK is taking steps in targeting the side effects and bad influence and the bad effects that loneliness has on health and the social structure.
Right. It's already in the conversation there. Whereas here, it's not so much.
Yeah, because it's more like, oh, okay, that's nice, that's sad, but it's your problem.
Exactly. I also think it brings up an important cultural difference between, honestly, like, people could argue that the United States and the United Kingdom are pretty similar in a lot of ways compared to the greater world. And even though, like, we are relatively similar when it comes to everyone, there are still interventions that are not going to work for a population that is that different.
Yeah.
It highlights the importance of international research and collaboration, because the things that work for some groups of people aren't going to work for others, and we need to know about them in order to effectively be able to treat our patients.
True that.
I like that. That's fun. Cool. Is there anything else you want to bring up?
Just to sum it up, the cost per person was pretty expensive.
Yep. In rural, especially, more than urban.
Yeah, because you need to actually bring them and everything. And it didn't really help. All right, thank you.
No prob.
All right, if that's it, then thank you for listening. I'm Tally Spaceman.
I'm Erin Carey.
And this was SRP Rex. And as always,
stay funky.
Hit me. Thank you for listening to the Senior Rehab Podcast. If you only listen to these podcast episodes, you are missing out on 90% of the Senior Rehab Project. Hop on over to seniorrehabproject.com where you can join the movement that's advancing care for older adults. You can join for free or become a part of the Game Changers where you can get some free gear and access to our monthly meetup. Just go to seniorrehabproject.com. I appreciate y'all, and I'll talk with you soon. But in the meantime, do not forget to stay funky.